Research makes it very clear that as you get older, penile tissue can undergo changes that affect both size and function. This is a phenomenon we call penile atrophy in the medical literature, and it's preventable if you implement the right strategies early. Hi, I'm Dr. Emma Blake, urology and men's health expert. I help men improve performance, protect their prostate, and feel their best at any age. In this video, I'm going to share the evidence-based strategies you can use to maintain optimal penile health throughout your lifetime. Today we'll cover what causes penile tissue changes as men age, the most effective prevention strategies based on clinical research, and if you're already experiencing changes, what you can do to support tissue health and potentially improve function. This isn't about unrealistic promises. It's about understanding the science and taking a proactive approach to your sexual health. First, let's discuss what causes penile tissue changes over time. As a urologist, I see this regularly in my practice, and it's important to understand the underlying mechanisms so you can address them effectively. The primary cause is decreased blood flow to penile tissue. Think of it this way. Your erectile tissue, like every organ in your body, needs adequate blood supply to maintain its health, structure, and function. When circulation decreases, tissue health suffers. As blood vessels age, they operate less efficiently due to endothelial dysfunction and atherosclerotic changes. Research published in the Journal of Sexual Medicine shows that endothelial dysfunction, damage to the inner lining of blood vessels, is one of the earliest markers of erectile dysfunction and can precede coronary artery disease by 3 to 5 years. Your body prioritizes blood flow to vital organs like your heart, brain, and kidneys. When cardiovascular health declines, penile circulation is among the first to be affected because it's not considered essential for survival. When penile tissue receives less blood flow, it receives fewer nutrients and less oxygen. This leads to what we call tissue atrophy. Essentially, the tissue shrinks and loses some of its structural integrity. Studies show that inadequate penile blood flow can result in measurable changes in both length and girth over time. Let me explain several key factors that contribute to these changes. First, nocturnal erections decrease with age. In your 20s, you typically experience 5 to 8 nocturnal erections during sleep. These aren't just random occurrences. They're essential for penile health. Research in the International Journal of Impotence Research demonstrates that nocturnal erections serve as natural exercise for penile tissue, ensuring adequate oxygenation and nutrient delivery. As you age, the frequency of these natural erections decreases, reducing this automatic tissue maintenance system. Second, sexual activity often decreases with age and life circumstances. Every erection is essentially exercise for your penile tissue. Studies show that regular sexual activity helps maintain penile blood flow, tissue elasticity, and overall sexual function. Reduced sexual frequency means less natural tissue exercise and maintenance. Third, testosterone levels naturally decline with age, typically about 1 to 2% per year after age 30. Research published in the Journal of Clinical Endocrinology shows that low testosterone not only affects libido and erectile function, but can also contribute to penile tissue atrophy over time. Fourth, metabolic changes play a significant role. As men age, many develop insulin resistance and increased abdominal fat. A study in the Journal of Sexual Medicine found that men with larger waist circumferences had significantly smaller penile measurements, both due to visual effects and actual physiological changes related to insulin resistance and inflammation. Insulin resistance damages blood vessels throughout the body, including those supplying penile tissue. It also interferes with testosterone utilization, even when testosterone levels are normal. Now that we understand why these changes occur, let's discuss evidence-based prevention strategies. The most important factor is maintaining optimal vascular health. Your penile health is directly linked to your cardiovascular health. First, focus on foods that support nitric oxide production. Nitric oxide is the key molecule that allows penile blood vessels to dilate for erections. Research shows that nitrate-rich foods like leafy greens, beets, and pomegranate can significantly improve nitric oxide levels and erectile function. A study in the International Journal of Cardiology found that men who consumed nitrate-rich foods had 30% better erectile function scores compared to those with low nitrate intake. Second, ensure adequate magnesium intake. Magnesium is essential for vascular health and smooth muscle function. Research published in the American Journal of Clinical Nutrition shows that magnesium deficiency increases inflammation and promotes atherosclerosis. Aim for magnesium-rich foods like nuts, seeds, and dark leafy greens. Third, avoid highly processed foods that promote inflammation and insulin resistance. Studies consistently show that men following Mediterranean-style diets have better long-term sexual function and less age-related decline. Fourth, maintain a healthy weight, particularly avoiding abdominal obesity. Research in the Journal of Sexual Medicine demonstrates that men with waist circumferences over 40 inches have significantly higher rates of erectile dysfunction and related tissue changes. Fifth, stay physically active. Regular exercise improves cardiovascular health, insulin sensitivity, and testosterone levels. A study in the Journal of Sexual Medicine found that men who exercised regularly had significantly better erectile function and less age-related sexual decline. Sixth, prioritize quality sleep. Most testosterone production occurs during deep sleep, and this is when your body naturally exercises penile tissue through nocturnal erections. Research shows that men getting less than 6 hours of sleep have significantly lower testosterone levels and reduced sexual function. If you're already experiencing changes, here's what the research shows can help support tissue health and potentially improve function. Step 1. Optimize vascular health through targeted nutrition. Focus on compounds that support endothelial function, the health of your blood vessel lining. Research shows that vitamin C supplementation can improve endothelial function and nitric oxide availability. A randomized controlled trial published in the American Journal of Clinical Nutrition found that vitamin C supplementation improved endothelial function markers in men with cardiovascular risk factors. Flavonoids from fruits and vegetables also support nitric oxide production. Studies show that men consuming high flavonoid diets have significantly better erectile function and less age-related decline. Step 2. Consider vacuum erection devices under medical supervision. While this topic generates controversy, the clinical evidence is actually quite clear. Vacuum therapy has been used in medical settings for decades, particularly for penile rehabilitation after prostate surgery. Research published in the Journal of Sexual Medicine shows that vacuum therapy can help maintain penile length and function in men recovering from prostate cancer treatment. A study in the International Journal of Impotence Research found that regular vacuum therapy helped prevent penile shrinkage in men following radical prostatectomy. The mechanism is straightforward. Vacuum therapy creates controlled blood flow to penile tissue, providing the oxygenation and stretch that natural erections would normally provide. However, this should only be done under medical guidance and with FDA-approved devices. If you're considering this approach, consult with a urologist first. Certain conditions like sickle cell disease or bleeding disorders make vacuum therapy inappropriate. When used correctly with medical supervision, vacuum therapy can be a safe and effective component of penile health maintenance. Step 3. Maintain regular sexual activity or stimulation. The principle is, use it or lose it. Penile tissue needs regular blood flow to maintain health. Whether through partnered activity or solo stimulation, regular erections help maintain tissue health and function. Research consistently shows that sexually active men maintain better erectile function throughout their lives compared to those who are inactive. Step 4. Address testosterone levels if appropriate. If you have symptoms of low testosterone, fatigue, decreased libido, difficulty maintaining muscle mass, have your levels checked by a qualified healthcare provider. Testosterone replacement therapy, when medically appropriate, can help maintain penile tissue health, improve sexual function, and support overall vitality. However, this should only be done under proper medical supervision with regular monitoring. Step 5. Lose excess abdominal weight. This addresses multiple factors simultaneously. It improves insulin sensitivity, reduces inflammation, optimizes hormone function, and yes, improves the visual appearance of penile size. Research shows that men who lose significant abdominal weight often report improvements in both actual and perceived penile size. Step 6. Consider targeted supplementation under medical guidance. While I always prefer getting nutrients from food, certain supplements have research supporting their use for vascular and sexual health. L-arginine, pomegranate extract, and French maritime pine bark extract all have studies showing benefits for erectile function and vascular health. However, supplements should complement, not replace, a healthy lifestyle. It's important to understand that while these strategies can help maintain and potentially improve penile health, realistic expectations are crucial. The goal isn't to reverse decades of aging overnight, but rather to optimize function and maintain the best possible health throughout your lifetime. Some men may see improvements in function, firmness, and satisfaction with these approaches. Others may simply prevent further decline. Both outcomes are valuable and worthwhile. From my clinical experience, men who take a comprehensive approach, addressing vascular health, hormonal balance, physical fitness, and regular sexual activity, maintain better sexual function throughout their lives compared to those who take a passive approach to aging. Remember, sexual health is an important component of overall health and quality of life. Taking proactive steps to maintain penile health is just as important as taking care of your heart, brain, or any other organ system. If you're experiencing significant changes in sexual function or have concerns about penile health, don't hesitate to consult with a urologist. Many issues that men assume are just aging actually have effective treatments available. The key is early intervention and a comprehensive approach. Your sexual health is worth investing in, and with the right strategies, you can maintain satisfying sexual function well into your later years. Take care of yourself because you're worth it, and you deserve to feel confident and healthy throughout your lifetime.